Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Mechanism of action of neuromuscular blockers. The neuromuscular blockers are of two types. There are depolarizers and there are non-depolarizers. Depolarizers causing neuromuscular blockade are these depolarizers will bind to acetylcholine receptors and they will cause action potential leading to muscle contractions and fasciculations are seen. This will cause refractory period of relaxation or phase 1 block. Non-depolarizers. Non-depolarizers are the competitive antagonists. In non-depolarizers, there is fading and post-tetanic potentiation is seen in the non-depolarizers, and this fading and post-tetanic potentiation is exhibited by non-depolarizers.
thank you and thank you for watching.